kita buka untuk presentasi. There are some public health specialists. Dr. Doni here. Dr. Iris Andono Ahmad is the expert on epidemiology. Professor Yati Sunarto with the white glasses. She's a pediatrician, outstanding pediatrician. She works on the rotavirus vaccines with Ruth Bishop since 1970s. Next to her is Professor Sofia Mubarika. She works mainly on the cancer, the HPV, EBV, HPV. So we are also strong on the cancer people. Next to Prof. Rika is Dr. Manchoromi is the anatomy specialist. We have also a young researcher there, Dr. Nungki. Can you raise your hand? So she published 2 papers on the hepatitis and HIV, and the second one was on the hepatitis, HIV, and the GBV interactions. I'm sorry I may not be able to introduce everyone, but this is time for Professor Uwud, where is she? Oh, she's over there. Professor Adi Utaruni, our Vice Dean on Collaboration. She is a specialist on hospital management, also on public health, so she's very well known on that. Some of these are the master degree students from the Center for Tropical Medicines. The one with the white coats are residents of the Internal Medicine Department. I know some, one of them is Dr. Sunarto Ang is our PhD candidate. I don't know his topic may be on TB because he works in Kalimantan. So that's kind of the blended audience here. So it's time for discussions. Please state your name and then just go forward with the questions. Yes, Professor Rika.
Yeah, thank you very much, Professor Anna Carlson and also Professor David. Welcome to Faculty of Medicine. It is really great to hear your talk, sharing scientific results from your research, as well as the program that you have been conducted so far. I'm sure those 2 topics that have been presented are very important problems that we faced in Indonesia, and both are global issues that we have to think together how we can prevent and overcome the outbreak and also the disease that can be arise from those 2 kind of viruses. My question is, you mentioned about concrete actions to improve the diagnosis, to improve the awareness, and also how can we work together. And as mentioned by Professor David, Indonesia with 240 million populations and inhabited in more than 17,000 islands. It's very difficult to, for the quick diagnosis, need to have equity of the professionalism, the equipments, as well as standardization of the methods. This is what we faced. And Professor David already mentioned that we need to have a concrete actions. But how we can start? Because we have more than 400 regencies with autonomous, because now decentralization, what I mean is decentralization where the budget is located at the regencies that make us difficult, as mentioned by Professor David. At the government level, the program is already there, but how it can be conducted as according to the standard, to the protocol, that also we know already that there's protocol and standardization, but it is so difficult to start with. So I think institutions our Faculty of Medicine that we have and scattered in many islands in Indonesia, mostly in Java, Sumatra, Kalimantan. How can we start to make a networking? And in fact, at the government level, we have what we call it under the NIHRD, PINERE, penyakit infeksi, non-emerging and re-emerging, where they coordinate the activities, include the avian influenza and all infectious diseases. I think we need to have a real activities to strengthen the capacity at every regions in Indonesia to be able to have the standardization of professionalism in diagnostic as well as the research that need to be conducted, because you said that reassortance of the virus that make the vaccine and also development of diagnostic need to be renewed from time to time. So I would like to have your both of you opinion about this kind of fact and how can we move forward to make our readiness of this to kind of disease for our community. Thank you.
Thank you for this question. Thank you for starting with an easy question. I acknowledge everything you've said. I think these are extremely complex problems. And I think Indonesia faces them to a higher level than many countries because, as you described, you have an enormous population, it's very widely dispersed, and your provincial governmental system means that powers are also, I think, quite dispersed, as I understand. So it's the less centralized a government is, then the more difficult it is to implement standard processes of government all across a country. So I recognize that Indonesia faces some very big challenges. And so there are many aspects to your question, and so I have to think just maybe one or two to say. I suppose the first thing is that you emphasize particularly capacity and standardization of testing and diagnosis, and I agree this is very important. And I think an important theme then is teach the teachers, and I think that Indonesia and other countries facing similar demands have the opportunity to draw heavily on the outside world. I mean, the whole of the world has faced a global financial crisis. Everybody is facing difficulties about how they spend money, and the wealthier countries are questioning how they spend aid money, and all of these sorts of things are challenges. But nevertheless, I think that there is a global network of people and laboratories and systems who are really wishing to engage and assist. And so on our very small scale, if we just consider influenza and just consider the WHO network and then just consider our own laboratory, we are very interested in helping and assisting in whatever way we can, and we already have a strong relationship with NIHRD in those terms. So there's the opportunity to obtain training and materials and systems from the outside world, but then the question is, how do you spread that through the country? And so I'm thinking of a domino effect where if you have absolute excellence of quality standards at NIHRD, then you have people who one would hope could teach the next layer out, and that you can keep transmitting that excellence all the way down the lab line into the provinces and local areas. I don't know how feasible that is, and it still depends on having an educated community of scientists or laboratory technicians in those more outer places, and so that is also challenging. But that is my first thought about it. Exploit what's in the outside world to get the capacity building within Indonesia, and then have a program to roll out that training elsewhere, because it's impossible, it sounds to me, to centralize everything in a country as large and as complex as this. The second thing about influenza specifically, different from hepatitis, is to think, well, what are the most important concerns for your country? And I suppose as an outsider, and with only a very limited view, avian influenza is more important than seasonal influenza. And I say that partly because of the economic effect on farmers of avian influenza, particularly H5N1, because it kills flocks. And so when you interfere with economic livelihood, you interfere with health and everything else, of course. And avian influenza, even if you only think of it as a agricultural problem and an economic problem and are less concerned about human transmission, that's still a very major one, I think, for Indonesia. I think the world is also looking to Indonesia, Egypt, and a few other countries to do what they can to contain H5N1 because of the human pandemic risk. So there will be much eager support, I think, for the further steps that Indonesia might take in focusing on the control of avian influenza. And so that, as a health problem, then it's operating differently from seasonal influenza, which will infect far more people. And then it's back to issues which are about policy and economy, and how do you encourage poultry farmers to let local authorities know that they have sick flocks. They need to be able to do that without fear. And they need to, and compensation, I know, is an enormous issue that's often talked about around the world, that where there are strong compensation programs for farmers who lose their flocks, then you are more likely to know about there being ill poultry. So those are issues which go way beyond my own expertise or authority to speak, but seem to me are very important considerations to think not only about immediate diagnosis and health related effects of avian influenza, but think about what other social and economic tools can be used to encourage local control that will save farmers the loss of their flocks, but also reduce the ultimate impact on human health.
Thank you. Thank you very much for the comment, and to add what has been addressed by Professor Anagkalso. Well, I agree that it is a complex, very complex, and that cannot be done just within one word or within 1 year. But the most important thing is we mobilize all resources. How? Well, at the global level, hopefully that the WHO, the Assembly, will accept this, because we still worried that some countries, I cannot mention it now, still reluctant, because they concentrate on hepatitis C. They just say, oh, there will be no longer hepatitis C. We don't have the what are we going to do for this? It is just putting energy to this. But they forget that the problems here is hepatitis B, which exists. 75% of the patients are here. And there are 30 points in the resolution that was passed by Executive Board last January, and all issues have covered many things that have been discussed and proposed by many countries. The first thing is that the positioning of the hepatitis within the department of the WHO, and then we recommend that WHO will take a lead in the control of hepatitis pandemic through their networks. The first thing is through the regional offices and their country offices, because they are close to the government. So, and also we need to encourage the donor agencies and others to consider that they can allocate certain budgets. Why? They can help other diseases, especially tuberculosis, HIV, and malaria. But why they still have question? I think because they don't see the data. They see that there are many cancer patients. Because the cancer association has acknowledged this, but the other, including the hepatology, have not acknowledged this. It's funny actually. And now in Indonesia, yes, we are in the process of preparing a 5-year strategic plan that will be used as a memorandum to the next government, and hopefully this will finish before this month. 17 August. So then in the development process, we will include other directorate generals. We can see if we go to the hospitals and see how the recording and reporting system of the patients, and they are under the Directorate General of BUK, Medical Service and Health Service. They don't use that system so that they not capture the data. That is the first is to coordinate within the Ministry of Health and regularly convey this message and if necessary instructions to the lower levels of health authorities. And we also collaborate and involve, not only collaborate but involve the active participations of at least 5 professional associations, that is hepatology. Of course, there's only a few people here in Indonesia, and pediatricians. This organization has lots of members. Obstetric and gynecology, POGI, because they haven't discussed it, but at the management level have agreed. And the clinical pathology, the laboratory, and finally, but not least, of course, the last is BIDAN, the Association of Midwives. It is a powerful organization. So we invited them last week, and we try to encourage. And also we use the system that has been used by HIV. So we try to learn from HIV how they could be successful. Of course, they have accurate data, better data, and so many. And we also want to involve stakeholders, civil societies, and all academic institutions. So they have branches, can penetrate regardless the level of bureaucracy. So those are the steps that are being taken and considered. So it's a big job, but we try to struggle. And don't forget to increase the awareness is to involve the role of the media. Thank you.
Thank you, Professor Kelso and Professor Moyono. I would like to call upon more questions from the public health perspective or from clinical perspective, please, or researcher perspective. Dr. Nuki, you have questions? Maybe you can share your data also on hepatitis among our HIV patients.
Thank you very much for this opportunity. My research is actually a simple research about the genotype of hepatitis B and C among HIV patients, and the frequency of this hepatitis virus is many. I think around for HPV is lower than HCV, but anti-HBs is very high, but the anti-HCV is very high also, around 35%, and the HBs antigen only a small number, because maybe 2%, 10% I think, 10% because they already achieved lamivudine for treatment, but anti-HCV is quite higher, around 30%, like that. Yes, and the genotype surprisingly various HCV. Around maybe 7 genotypes we found, and maybe it's showing the various transmission due to maybe the IDU injection drug use and the distribution of drug use around the world. And I want to ask to Dr. David Mulyono, nice to meet you here, because you are the chairman of the enrichment laboratory, so maybe we can have a collaboration in the future. So have you already started the HPV and HCV research in your lab or not, among HIV patients specifically? And how do you think about that? Because my research is so simple. In other countries, it's very specific. They have already do the, for example, in vitro study, and also on associating with the antiviral drugs also, but we do not start yet so specifically. So what do you think about that? Thank you.
Thank you, and I'm very happy that you have started this good study. I think you have to publish this. Look at the example from Egypt, yeah, because if there is no data, the problem is not known. Yeah, the first is, before I forget, that hepatitis B in the presence of HIV often manifests an occult hepatitis B. It is already widely accepted, occult hepatitis B, because of some problems in the polymerase, and some proteins are not expressed. But how high is the anticore, anti-HPC? You can guess from that, and those who are anticore, anti-HPC positive can be continued with HPV DNA extraction. So I think that is one step. Yes, we studied many samples from many places from Indonesia, and I remember that Dr. Nanang, pediatrician, sometimes also, I remember several years ago, came to Aikman. Yes. Well, you are welcome if you come to Jakarta, or you can communicate with us by email. Okay. And why don't you put this in application to the research desk? It has been opened. I think it is still open until the 30th of June. Just write a proposal and then sign by the dean and send. Okay, you can put us or one of us as a collaborator, not as the PI, of course. Yeah, the PI should be local.
Yes, Dr. Chitra. She's an epidemiologist in the Department of Public Health.
Dr. Yandri, I have a question. David Mulyono. I'm the one, I'm not sure if the surveillance is not established yet in Indonesia for hepatitis C, but in my understanding, I think the hepatitis surveillance is not put in the specific one for hepatitis surveillance, like HIV surveillance, like TB surveillance, but it's still integrated with another neglected disease in Indonesia. But I want to know more from you. How is the current situation of the hepatitis surveillance in the national level? And what is the current practice? And do you think any lackness in the surveillance system? So many people think that we do not have a good data on the hepatitis C yet.
Thank you. You have to be embarrassed to answer this question. My short answer is there is no standardized national surveillance system for hepatitis. But we try to study by different approaches, from blood donors, which is not accurate, and also from pregnant women. Because the Bapenas has agreed that the Minister of Health will study 80,000 women next year. Hopefully, if we can catch the data, at least women is half of the population, right? Roughly, so we can predict and extrapolate the data, and also we can also see the necessity to give treatment to pregnant mothers. Okay.
Yeah, I don't think we have a Department of Hepatitis in the Ministry of Health. Subdirectorate Hepatitis.
Yeah, yes.
It's recent, eh?
It is led by Dr. Naning Agustini.
Okay.
I'm happy because she has experience, 17 years experience to work with HIV.
HIV, yeah.
Yeah,
Okay.
you know,
I was
you
learning.
know her.
Okay. Yes, Chitra has.
Yeah, this is for Prof. Kalso. You explained very interesting about the surveillance of influenza, but I'm just wondering, have you also have the data on the surveillance of the influenza in the avian, and how do you correlate it? Because in my understanding, the pandemic in human also correlate with the pandemic in the avian. Thank you.
Thank you for this question. And in fact, you raise a very complex issue for many countries, and that is that we don't have close enough interaction in many cases between human health surveillance and animal health surveillance. And so what we do in the WHO system is that we are trying to strengthen the ties with the World Animal Health Organization, OIE, and there's a section of that called OFLU. And so they come along to our meetings in Geneva when we discuss, when we review what has happened for the last 6 months and we make new vaccine recommendations. So it's getting better and better that the animal data are discussed alongside the human data, and WHO then makes recommendations on animal virus vaccines that could be used in the event of a pandemic. So that's one very important way we have interaction. But the WHO collaborating centres don't do animal influenza surveillance because we're all human laboratories, but it varies from country to country how well there's integration of the data from the different systems in countries. But I hope through this WHO-OIE interaction we'll get much more sharing of data. I don't know how it works really in Indonesia. Because I know you have, you do have avian influenza surveillance, and I know that you have a strong collaboration in Indonesia with the Australian Animal Health Laboratory in Geelong. Geelong is where I grew up, so it's my hometown. But the Australian Animal Health Laboratory has had a long relationship with Indonesia, and scientists from there have spent many years working here, and so. I know you have important data from that. But it is a problem in our country, and it's a problem in many countries to have a good enough connection and conversation between public health and animal health people. We have the problem in Australia, I think, that many countries have, that agriculture is considered primarily an economic issue, and human health, of course, is a public health issue, and so the drivers are different. And so where the driver for considerations for animal health are economic, they are not really taking into account the consequences for human health. And so that's also an educational process for animal health people to start to think more about the impact on human public health as well as on animal health and economic activity. So that's an issue in our country. I know it's an issue in the United States, where the Department of Agriculture is very powerful and doesn't always want to talk to the CDC. And I think this sort of thing happens in many countries. So I think that's an ongoing discussion to try to break down those barriers and to appreciate the idea of one health. You know, that animal health and human health are very closely intertwined, and so we need to consider the whole picture, not each thing in isolation. So that's a long answer to your question, which doesn't directly answer your question, but it just reflects some of my thoughts on this very important subject. Thank you.
Okay, before I kind of make a summary and some of my notes also on the answers, but Professor David Moyono has 2 minutes or 3 minutes talks on the issues. Okay, time is yours.
Thank you very much. Well, in my second presentation, which will be in the form of PDF, I try to show and share some data and also show some research opportunities either from host and agent. So the title is Host-Agent Interaction, Hepatitis B as a Model. If you need to know further about the data and the approach, you can directly write to the names of the investigators that I put the name, because they some data are also still midway because they haven't finished yet, but you can have this, and I hope that there will be some new data, a new contribution from Jogja. Thank you very much.
Thank you, Professor Moyono. Any last burning questions before I kind of wrap up? Professor Uut? Okay. Okay, time is, considering the time, it's 12 o'clock. Some of us has to move on. But I make notes of the questions and answers also. Professor Kalso, unfortunately Professor Widya Asmara does not attend this meeting. Widya Asmara has extensive work on avian influenza, so yeah, he sees the NAHA receptors all in the animals because he's a veterinarian. But for sure, I will give him your email. And yeah, because I also work in the Center for Tropical Medicine, that's why I know many of the master degree students did a lot of the sequencings. I don't know, I'm not very much sure about the publication itself, but I know that he also sent all the sequences to the WHO data bank, I guess, the gene bank for this, for sure. That's because he did a lot of work. I think it's more than 5 years by now. So I'll make sure that he noted and because this will answer also Dr. Chitra's questions on the receptors in the I know he did it in the chickens, in the, what is pepe? Duck. Okay. Ite and pepe and whatever. So he did a lot of work on that. So and it's from Purworejo. It's in the southern part of Jogja and everything. And I think, Prof, I just want to remind, we have a strong team on One Health. So this is actually maybe an open opportunity for research collaborations, either from it's both the combinations from the biomedical and also the public health perspective. One Health, the leader is, one of them is from here and also from Dr. Wayan, Prof. Wayan, from veterinary medicine also. So we will give you the issues on the One Health. We are starting, some of our master thesis is also trying to work out on the One Health issue. But due to the constraints of probably the funding for research is mainly on the public health side and not yet on the host and agent interaction. So I think that's one opportunity One Health can be used in here. And then for Prof. Moyono, I will send you Nunki's paper. It is published. Both of them are published. So I will send you on that. I would like to mention that in the hospital we don't have the surveillance system on hepatitis B. We do have the surveillance system on HIV, but not the surveillance form for hepatitis for patients in the ward. Nggak ada ya, di Bangsal nggak ada ya. Kita melaporkan hepatitis B ya. We only put it on the patients. We know which patients is positive, but we don't have the form that we have to fill in and to put in the dinas. Yeah, exactly. I think one opportunity is also to work with the nephrologists because we have a very high prevalence of hepatitis B and hepatitis C in the hemodialysis populations. I think it's around, because I was much involved with the Nephrology Society of Indonesia for several years before before I was very concentrating on HIV. So I think they have the data also, the Pernefri. I think it's around 30 to 40% of prevalence. So it's very high. And if so, we might look up the standard costing for hemodialysis if we can put it into the insurance systems to have hepatitis B and C as the standard, and also HIV actually the standard protocol before starting before starting hemodialysis. I think it would be good to do that. We don't know whether for sure it is not an incidence. We don't have the incidence. I mean, because we also use a reuse system of the filter. So this is also an interest of research. How many percent of patients maybe develop hepatitis B after several years of hemodialysis? So it's an open opportunity also for that. And then we already put hepatitis, considering Professor Rika's questions on how we can campaign the vaccinations. In regards with the decentralized system, we make emphasis on the basic immunizations, that it has to be covered by the district. So the MOH will fight with the MOHA, the Home Affairs, to make sure that all of these packages should be covered by the local government. This is what happened with the decentralizations in Indonesia, because everything is put into the district level, which is around 500 districts, and the health matters is not, straightforward put into the obligations of the head of the district or the governor. So we will. I'm lucky that the past 1 or 2 years I've been involved with the health office associations, and we try to make sure that this will be put as the funding from the district itself, so they don't have to wait for the central government to do that. And lastly, maybe I would like to say to the researchers and the clinicians, adik-adik saya residen with the white coats, saya selalu mengatakan di laporan pagi bahwa sebagai klinisi kalian juga mempunyai tanggung jawab terhadap public health. So as a clinician, you are also responsible for the public health. So if you see maybe it's kind of increasing awareness of the influenza, that means you also have to know what is their, what do they live for? I mean, are they farmers or whatever. So this is also a starting point. And also, what do you do if you see a patient with hepatitis? You have to screen for the spouses and everything. That's also a simple clinical, but has an impact on public health. So, paham ya maksud saya ketika saya banyak berbicara sebagai klinisi, tidak berhenti sebagai satu pasien, tetapi melihat juga pasangannya juga hepatitis atau tidak dan sebagainya. Karena itu starting point where you can trace who is vulnerable for the next infections. That also occurs for influenza. And also what we learned from both slides, you see, especially on the influenza, there is the seasonal and there's also the pandemic. So as in the clinicians, you have to be alert also what is happening around your area. Now there's the MERS-CoV increasing. Maybe some of you will work in the district. Some of the people in your populations come from Umrah, come from the pilgrim. You might have to be aware of that also. And this is also your task to talk to the health office, that this might be an outbreak if someone already come with a fever coming to you with the sign and symptoms of influenza or with pneumonia and everything. So this is kind of the message. And also the researcher here can work together with the clinicians, because we have a lot of patients inside hepatitis B. I know it is very prevalent inside the hospital, and how we can also infection controls for hepatitis B and the airborne infections in the hospital. So it's kind of the opening area. Because my field is both on the clinical and researcher, that's why I kind of put that into the perspective of this. I hope that kind of closes everything. Yeah, any burning questions? Any final remarks wanting to be stated by anyone? Yes, Prof. Rika.
Vice Dean of Research and Postgraduate Program have another task right now, and she asked me to forward her appreciation. And if you don't mind, I would like forward this appreciation from the faculty for both of you.
I think we should have a big applause for Professor Ann Kelso and Professor David Mulyono. And then we would like them to stand over here. That was kind of the official opening of the sessions. I hope it has been a very fruitful discussions, and also useful for the young ones, and then how we can move forward in the faculty. Thank you, and thank you so much. Okay, will you please stand over here?
Thank you, Dr. Yandri Wijayanti Subronto, as a moderator for today's seminar. And now, may we invite Professor Sofia Mubarika to deliver a sort of letter of appreciation to honorable speakers, to Professor Enkels and Professor David Mulyono. Depan TV ya, Bu.